All right, hello everyone. This is Dr. Tan. Sorry we had some technical difficulties, but our wonderful IT guy Chris was able to fix them. Sorry we're starting a little bit late. My name is Mimi Tan. I am one of the newer bariatric surgeons here at Eviva, and I'm very excited to be giving this seminar today regarding weight loss treatment and bariatric surgery. This whole session is going to take about 20 to 30 minutes, I'm hoping. The first portion is where we'll talk a little bit about the contents of this talk and some of these topics above. And then we will spend the last bit of this session answering your questions. If at any point you do have questions during this talk, feel free to put them in through the YouTube chat. We already have a couple of questions sent in already. But alternatively, you can also just text us directly with your questions at this phone number right here. This will stay up during the whole talk, so feel free to text us at any point. Anyways, let's get started with this talk. Okay, so I want to start this talk out with a simple question, and that question is weight loss hard? And it might seem like a silly question to ask for a seminar like this, but I think it's actually an incredibly important question. And I think the reason why it's such an incredibly important question is because we as a society have actually answered this question incorrectly. What we have decided is no, weight loss isn't that hard. All you have to do is eat a little bit less, maybe exercise a little bit more. Weight loss should be easy. It's not hard at all. And if you are here today, I applaud you because you have heard that over and over and over again in your life. And you have decided at some point to say, no, actually, I don't think everyone is right. Weight loss is incredibly hard. What more can I do to maybe help myself with this process? And you are absolutely correct. And I'm going to tell you why you're correct. Now, I really like having numbers, I like having data, and this is a graph from the CDC. And this graph shows a couple of different things. Each of these lines represents a BMI category. You who are unfamiliar is a ratio of your height to your weight. It's not a perfect reflection of your health by any means, but we use it very frequently in kind of the medical world. Now, depending on your BMI, we have different kind of categories. You have normal weight, overweight, and then you also have obesity. And within obesity, there are also several subcategories. Now, what this graph shows is trends of BMI over time, over the last about 50 years in the US. And this graph shows two main things. One is that obesity has actually been increasing steadily over the last 50 years. The second point that I want to point out is that in 2018, rates of obesity in the US was about 40%, actually over 40%. And rates of being people who are overweight is also around like over 30%. And so overall in the US, more than 80% of people are either overweight or obese. And again, BMI is not perfect by any means, but what this really tells me is that most Americans are struggling with their weight in some way. And this graph simply would not exist if losing weight was easy. It only exists because losing weight is incredibly hard. So let's talk a little bit about why losing weight is so hard. Losing weight is so hard because there are so many different aspects that contribute to how much you weigh and how difficult it is for you to lose weight. Now, some of these things, and we've listed most of these things in this like little figure here, some of these things you do have some control over, right? You can control what you're eating, you can control your diet, you can control your exercise. To some degree, you can also control who's in your support system and what your mindset is. But one of the really big things that you cannot control when it comes to how easy it is for you to lose weight is your biology, okay? Your biology is who your parents are, right? What your genetics are. what your body chemistry looks like, what your hormonal balance looks like. These are things that you have no easy control over, and they actually have a huge impact in terms of how much you weigh and how hard it is for you to lose weight. Okay. And so if you are someone who has tried over and over and over again to lose weight and you have not been successful, what I want to tell you is that weight loss failure, so not being able to lose that weight successfully, it's not a moral failing. It's not because you haven't been trying hard enough. It's not because you don't have enough willpower. It is a failure against your biology. It is a failure against all those things that we have talked about before that you do not have control over. And I just said that you don't have control over your biology, and that is actually not strictly true. We're going to talk about some tools today where, yes, you do need a physician or you do need a medical provider to help you get these tools, but these tools do give you some of that control back when it comes to your biology. And we'll talk about those tools. Now, the three major tools when it comes to medical weight loss, I call this your weight loss toolkit, is going to be lifestyle changes, so diet and exercise, medications, and then finally bariatric procedures. And we're going to talk about each of these in a little bit more detail. Now, diet and exercise, this is going to be your least effective tool when it comes to weight loss. If you have a substantial amount of weight to lose, the success rate of being able to lose that weight and then keep that weight off is actually very, very low, probably around 3 to 5%. And so really, most people who try to lose weight with just diet and exercise are not going to be successful. People tend to have a little bit more success if they have medically supervised weight loss, meaning you have a physician or you have a medical provider who is kind of monitoring you and supporting you through that weight loss process. But the success rate is still not very high. And so it's going to be your least effective tool when used alone when it comes to weight loss. Now, I do not want to knock diet and exercise too hard. And the reason why is diet and exercise, and diet in particular, is absolutely foundational when it comes to weight loss. What do I mean by that? I mean that if your lifestyle is not conducive to weight loss, meaning that you're eating unhealthily or you're not eating the right things, you are not going to be able to lose weight even with some of these tools that we're going to talk about later. So diet is absolutely foundational. If you don't eat correctly, nothing else is also going to work. These tools are just going to help you kind of with some of those diet changes a little bit more easily, and it's going to help you lose weight in some other ways as well. All right. Okay, so let's talk about medications. Broadly speaking, there are two classes of medications when it comes to weight loss medications, and those are going to be your non-injectable drugs and your injectable drugs. Now, both of these types of drugs are going to broadly work in a couple of different ways, but generally speaking, they're going to either work by, one, kind of curbing or decreasing your appetite, and two, they might also work by working directly on your stomach and slowing the emptying of your stomach. And what happens with slowing the emptying of your stomach is it's going to make you feel fuller earlier, and it's going to keep you fuller for a longer period of time. Okay. Now, the non-injectable weight loss drugs, these drugs we've actually had on the market for quite a long time, and we know we've been using these drugs for quite a long time as well. These drugs, generally speaking, are going to be either pills or capsules, and you take these pills once a day, usually. And these drugs are going to be somewhat effective. The weight loss that you can expect with some of these medications ranges anywhere from like 5 to 10%. The benefits of these drugs are, again, we've had these around for a long time, and we've been using them successfully. And again, it's a pill, so you don't have to do anything more than just take a pill by mouth. Now, the other category of medications is going to be your injectable drugs. These are the newer drugs on the market. These are the drugs that you're hearing about on social media and then in the news. It's the Ozempics, the Wegovy's, the Mounjaros. These drugs you are going to inject usually once a week in your arm or your leg, And why you're hearing so much about these medications is that they're very effective, much more effective than any of the non-injectable drugs that we had been using previously. The expected weight loss with some of these medications is around 10 to 15%. Now, some of the downsides with these newer weight loss medications is that, again, you do have to inject them, which some people do not like, but it is only once a week. The other downsides right now are that we don't, because they're so new, we don't have a lot of long-term data in terms of both how effective they are and some of the long-term side effects that we might see with some of these medications. What we do know is, again, that they're very effective from like the year to 2 year long studies that we have. The other big downside that I see with these medications right now is that they're very hard to get a hold of and they can be very, very expensive. There are insurances that are covering them now, and so I would definitely check if you're interested in one of these medications. But if your insurance does not cover these medications, they can be very, very expensive, and not just kind of not affordable for most people. Another question that I hear a lot about medications is, what is the long-term durability of these medications? Do I have to stay on these medications for the rest of my life? And I think the straight answer for that is that we don't know for sure. The tendency that we see with these medications is that when you come off of them, the weight loss slows and there is a tendency to see the weight come back. So generally speaking, when we prescribe these medications, we intend to keep our patients on them for the long term. Now, if you have been on one of these medications and you do want to come off of it and you've been successful, I will never tell you that you can't come off of them. So what I would recommend though is that you do it in a way that's monitored, so we can keep an eye on you, watch your weight with you, and kind of do it in a way that's kind of monitored as a process. All right. Okay. Moving on. Next is bariatric surgery. This is my favorite topic. This is going to be your most effective tool when it comes to weight loss. Total body weight loss is about 25 to 30% with a bariatric surgery. And beyond just weight loss, while weight loss is very important, it also has been shown in so many studies that it addresses so many different things. It addresses pretty much any disease that is associated with being overweight or obese. So things like diabetes, high blood pressure, sleep apnea, these are all likely to improve with bariatric surgery. On top of that, we know that bariatric surgery decreases your risk for strokes, heart attacks. It decreases your risk for dozens of cancers. It's really amazing some of the changes that you see with bariatric surgery beyond just the weight loss. Who qualifies for bariatric surgery? This is a little bit of a complicated question right now, actually. So if you are unsure after this talk, I would encourage you to reach out to a healthcare provider or send a message to us to talk about whether or not you qualify. And the reason why it's kind of confusing right now is that major bariatric societies, medical societies, decided last year to update their guidelines. The new guidelines are anyone with a BMI greater than 35 or anyone with a BMI of greater than 30 with any of those diseases associated with being overweight. So like sleep apnea, high blood pressure, diabetes, those types of health problems. These are the people who are most likely to benefit from bariatric surgery. So if you fall into this category, we think you might benefit. Unfortunately, insurance guidelines or what insurance covers has not quite caught up to these newer medical guidelines. They're still using some of the older guidelines, which is a BMI of greater than 40 or a BMI of greater than 35 with diseases related to being overweight. Right. Again, I think if you're confused after looking at some of this, talk to someone who might be able to help you. That can be us, that can be your PCP, whoever. All right. Okay. So what is bariatric surgery? What does it look like? Walk me through the process a little bit of if I were to undergo bariatric surgery, right? So bariatric surgery these days, it is done laparoscopically or minimally invasively. And what I mean by that is we're talking about the incisions that we make during bariatric surgery. We are going to be making very, very small incisions. The biggest incision that you're probably going to have is about an inch in size, and most of them are going to be actually half an inch in size. And we make several of these small incisions. We put a thin, long camera into your belly, and then we put instruments in through the other incisions to do the entire surgery. This is a big change from what we were doing years ago, maybe 20, 30 years ago, which was open surgery. Open surgery, we make a big incision from your chest bone down to below your belly button, and you have this big, 20 centimeter incision. As you can imagine, transitioning to laparoscopic surgery has made recovery time so much faster for our patients, and it's really improved pain after surgery as well. And so nowadays, pretty much all bariatric surgery is going to be done through these little incisions. Now, the options that we have when it comes to bariatric surgery, there's a lot of different options, but the two main ones are going to be sleeve gastrectomy, or the gastric sleeve, and the gastric bypass. These two procedures, they are going to constitute more than 90% of bariatric surgeries that are performed in the US today. And we'll talk a little bit about each one. Let's talk about the gastric bypass first. The gastric bypass, what we do during the gastric bypass is we make a very small pouch with your stomach, about the size of an egg, and then we bypass the rest of your stomach, as well as the first portion of your small intestine. And then we hook up the another end of your intestine and bring it up to that small egg-sized pouch. And so what we're doing with the gastric bypass is we're limiting how much food can go in your stomach at one time. Again, that's that small egg-sized pouch. And then we're also bypassing a significant portion of your small intestine. So it limits how much food you can absorb at one time as well. The gastric bypass, we've been doing this for a very, very long time. We've had a lot of good results and good data from the gastric bypass. Gastric bypass takes about 90 minutes to 2 hours to do. And our patients generally will stay overnight with us after the gastric bypass. Now, the other procedure is the sleeve gastrectomy, or the gastric sleeve. And what we're doing with the gastric sleeve is we're taking out most of your stomach. So we're taking out about 80% of your stomach actually, and we leave you with a thin banana-shaped stomach. And that's the entire procedure. And what the procedure does is it's limiting how much food can go in your stomach at one time. This procedure takes about an hour to do, and most of our patients can actually go home the same day of their surgery. All right. Now, when it comes to choosing between the sleeve and the gastric bypass, this is a very personal decision. There are also going to be some personal medical history aspects that might push us one way or the other. And so that is a discussion that we would have during your surgery, or during your surgery consult. All right. All right. One other procedure that I wanted to bring up is the endosleeve. And this is a very new procedure, but it's very exciting. With the endosleeve, this is actually not a surgery. Technically speaking, it's a procedure, but the endosleeve, or the endoscopic sleeve gastroplasty, sometimes you'll hear it as just ESG for short. What we're doing with this procedure is we actually go in through the mouth with a long, thin camera. We go into the mouth, through the esophagus, into the stomach. And through that camera, we're actually able to put in sutures internally into your stomach. And as we're throwing in these sutures internally, it scrunches up your stomach and it reduces the inside of your stomach. And so effectively what it's doing to the inside of your stomach is it's mimicking what you would get with a sleeve gastrectomy. It's severely limiting how much food can go into your stomach at one time. Now with the endosleeve, what we have been seeing is about 20 to 25% weight loss. So not quite as good as bariatric surgery, but getting very close. And the big benefits of the endosleeve are that you do not have incisions, and potentially, it is also a reversible procedure if for some reason you wanted it reversed. All right. And so I will say this is a really great option if you are not quite ready for bariatric surgery, in my mind. Again, we're getting very good results doing this as well. Now, briefly, I want to bring up two big bariatric surgery myths. I hear these two statements all the time, and so I do want to just kind of briefly talk about them. The first myth that I hear, again, all the time is that bariatric surgery is so extreme. I hear this a lot from patients. I hear this a lot from patients' families and friends who are just genuinely worried about them. And I totally understand where people are coming from with this. Bariatric surgery is surgery, right? We are putting you to sleep. We are making incisions. It's going to be surgery. But what I want you to know is that bariatric surgery is extremely safe. It is actually one of the safest procedures that is done today, anywhere. If you go to any given hospital on any given weekday, and you look at all the surgeries that are being done that day, bariatric surgery is actually going to be one of the safest procedures on that list. It is on par with gallbladder surgeries or a knee replacement. It has one of the lowest complication rates, again, of anything, a lot of the procedures that we do. So when I look at the idea of bariatric surgery being so extreme or being so risky, I'm thinking about if you do not have bariatric surgery, some of the risks that you're taking on with being obese, having some of those potential medical problems down the road, like diabetes, high blood pressure, some of these different things that we talked about already, that risk far outweighs oftentimes the risk of bariatric surgery. And again, this is something that we can talk about more in detail when you come to us for a consult. All right. The other big myth that I hear is that bariatric surgery is the easy way out. I hear this all the time. And the truth of the matter is that bariatric surgery is a tool. All right. Anytime we have something hard to do, what we don't want to do is just keep doing things the hard way, keep doing things the hard way. We want to have a tool that makes things easier for us, right? It just makes sense to do things that way. Bariatric surgery, it's not a magic bullet. It's not a magic wand. If I give you a gastric sleeve or a gastric bypass, you will maybe lose weight, but you will regain that weight if you do not use your tool successfully or you don't use your tool in the right way. Okay, every single one of my patients who is successful after bariatric surgery still has to work very, very, very hard to lose their weight and maintain their weight. All right, and so again, bariatric surgery, it makes losing weight a hell of a lot easier, but it is not going to just happen on its own. All right. All right. This is a kind of chart that I made that reviews everything that we've already talked about. This is a great slide to kind of just take a picture of or take a screenshot of if you are on your phone right now. All right. Okay, really briefly, I want to talk about what is Eviva. Eviva is our group here in Shoreline, Washington. For those of you who are unfamiliar, Shoreline, Washington is just a little bit north of Seattle. And this is really only relevant when you come to us for surgery. You do come to us in Shoreline at our Eviva building for surgery, but we offer all our other visits through telehealth if you would prefer it that way. I love it when my patients come to see me in person, but I totally understand how busy everyone is and how inconvenient it is to drive around Seattle. So again, we can do all our visits via telehealth and then we can meet in person during your surgery day. All right. But I think more important than what is Eviva or where is Eviva is who is Eviva. And I think this is incredibly important for anyone who is considering bariatric surgery or considering weight loss medications, is who is the team who is going to be taking care of you, right? And it's not just who is your surgical team. Of course, your surgeon is going to be very, very important in your process, but it is who is the entire team who is going to be taking care of you. Who are the dietitians? Who are the MAs who are going to be taking your phone calls? Do they have a coordinator who's going to help you through the process of getting prepared for surgery? Who are my people before surgery and who are my people after surgery? Bariatric surgery, this is a lifelong process. Surgery is just the beginning of your journey. I'm giving you a tool when I do bariatric surgery for you. But if you do not have people who are going to teach you how to use that tool, if you don't have people who are going to support you and help you maintain that tool, you're going to be less successful. So it's so incredibly important to have a great team with you. And I think our team is amazing. I trust every single person on our team, and I think they do a great job of caring for our patients. All right. So if you're interested in learning more about us, this is our website, evivamd.com. On the front page, there's a little tab that says contact us. So if you go to that and fill out the form, you will get a phone call or a text from us afterwards to talk about your next visit with us. All right. And that is the end of our talk. I'm going to start answering some questions now. Okay. All right. So let me just open up texts here. So we got one question. I have Kaiser insurance. Am I covered? So Kaiser is a difficult insurance, and I'm not the person who is going to talk to you about insurance if you go through the process. My understanding is that Kaiser has their own surgeons, and so if you wanted your Kaiser insurance to cover your bariatric surgery, you would have to go through Kaiser, unfortunately, to get your bariatric surgery. I don't really fully know what that process looks like. I wouldn't be super helpful there. That said, we will still take care of patients who have Kaiser insurance. We do have self-pay options, and that is something that we can have our coordinators talk to you about. If you're interested, just give us a call. All right. All right. What other questions do we have? All right. I have a question texted in. I heard that you cannot drink coffee after bariatric surgery. Is this true? That's a great question, and this is a question I get from patients all the time. I love coffee, so this would be very concerning for me as well. The reason why we want you to wean yourself off coffee prior to surgery, and I usually tell my patients to do this about a month ahead of time, maybe a little bit less, is not what you might think. What some people think is that you shouldn't drink coffee after bariatric surgery because coffee is dehydrating and you're at risk for dehydration after surgery. Certainly, coffee is not as hydrating as, say, drinking a glass of water, but coffee is still going to give you fluid that stays in your body and is going to overall hydrate you to some degree. But the reason why we want you to wean yourself off coffee prior to surgery is for anyone who's an avid coffee drinker, they know that if you suddenly stop drinking coffee, you get these terrible rebound headaches. I get these all the time. Every once in a while on the weekends, if I skip my morning cup of coffee, I get a headache later in the day, and they're not fun to deal with. And what I don't want for my patients is to be dealing with these rebound headaches and this caffeine withdrawal after surgery. And the reason why you can't, why you might have that withdrawal after surgery is you're no longer able to drink your full cup of coffee that you were able to drink prior to surgery. And so while you're recovering from surgery, I just don't want you dealing with on top of that caffeine withdrawal. All right. So it's hard. I know it's hard to not drink caffeine, but it's helpful for the entire process, I promise. All right. What else do we have here? All right. Can you talk about the new weight loss drug that just came out? Yes, we can talk about the new weight loss drug that just came out. I believe the new weight loss drug that this person's probably talking about is Zepbound. This is a medication that was just approved for weight loss purposes, I think about 2 weeks ago by the FDA. The things to know about Zepbound are that it is actually a drug that has been on the market already. Zepbound is the brand name for the compound called tirzepatide. Tirzepatide already exists as Mounjaro. And Mounjaro is currently used. Mounjaro is the brand name, but Mounjaro is currently FDA approved for the treatment of diabetes. And what they found, so this medication was originally made for diabetes, and what they also found is that it also resulted in significant weight loss. And so they turned around and made this drug that's the same as Mounjaro, same as tirzepatide, but now it's called Zepbound, and now it's approved for weight loss. It's a super exciting medication. It's kind of a cousin to the medications that are already out, the semaglutide or Ozempic or Wegovy. It works on a receptor called GLP, which is going to work on your stomach. It also works on your brain, and it's going to significantly reduce how quickly food moves through your stomach. It's going to keep you fuller for longer. It's going to make you fuller faster as well, and it's also going to curb your appetite. On top of GLP, it also works on a different hormone called GIP, which is also working similarly, but it essentially works on both of these different hormones. And what's really exciting about this medication is that the studies that have come out regarding this medication are much better than even the other injection medications that we have on the market right now. Again, these studies are not very long term, but these like year and a half long studies have really exciting results. And so hopefully that medication will come out in the next few months. I expect that it will still be very hard to get a hold of. I think it's supposed to be a little bit cheaper than Ozempic or Wegovy, but not significantly cheaper. So it might still be very expensive as well if your insurance doesn't cover it. But very exciting to have another medication available. All right. Let's see. Any other questions? I think that is it for tonight. All right. Well, again, thank you so much, everyone, for tuning in today. These are really fun sessions for me to do. I really enjoy kind of answering questions for people. If any questions do come up at any other point, feel free to just comment in this YouTube video. This live stream will be turned into a video. Feel free to comment. We monitor those. I'll answer them at our next seminar, or tune into our next seminar and we can just ask me the question then as well. Okay. All right. Take care, everyone. Goodbye.